The MOZOCARE is basically a brand which has been floated by India Healthcare globally. We started up with a mission of letting people understand how exactly they can approach towards accessing medical treatment abroad. And obviously, India being one of the primary destinations, a home for us, and that's where we leverage each and every competency and expertise of India in terms of delivering to the world. With a global capability to assist everyone's requirement. Now we have been hearing out there a lot of presenter yesterday, from the insurance to assisting companies to attendants, travel companies, and the government setups. You will find some of the finest answer to your all queries here. We are headquartered in New Delhi, India, globally having a presence in Hong Kong, Shanghai, Lubumbashi, Kinshasa in the DRC. We have access to Addis Ababa again in Ethiopia, Dar es Salaam, Tanzania, and major part of Nigeria. We have been very, very focal in terms of Francophone countries, covering West Coast entirely. The hospital services from over 12 different countries come together on a platform. Why? Because we are having one of the finest, highly efficient and effective trained team, not only from the travel industry, but also from the medical fraternity. We are having the people from each and every aspect of the healthcare industry. The experience in multiple therapeutic areas, which position us absolutely unique. We have been hearing out some of the people, having the multi-locational approach, and that's where we are. We have been localizing ourselves in all respect. So MOZOCARE is primarily a curated marketplace which simplifies complex procedure for booking a medical travel, which people can do online, right? 200 plus highly qualified, internationally accredited hospitals been listed from over different countries. Medical procedures has been again curated, evaluated on hospital-wise basis. So we don't just send a patient to specific hospitals. No, in general, we send the patient specific for the specific procedure under the guidance of certain team in the hospital itself. We speak multiple languages. I'll take up that further. That's where the global delivery model is. We are based in New Delhi. We are having a back office over there, which controls all kind of a procedure when it comes to the delivery of services to the patient, to the stakeholders, insurance companies, government institutions, as well as the hospitals. The local support team in each and every country, wherever I have said so far, we have covered West Africa and large. Our integrated centralized process, where if you can find the MOZOCARE very much in a central, we process as a one-stop service provider. We have integrated ourselves with many of the hospital system where we are carving ourselves, delivering those informations, critical informations to the patients, to the hospitals, treating local doctors, as well as to the family and other affiliates. We start with documentation, we take the patient care, knowledge sharing, which is another platform on the MOZOCARE itself, which help us in terms of sensitizing the local society, sensitizing the local government establishments for taking up different kind of projects locally. It's again country-wise metrics where which country is providing what kind of the service provisioning, the primary and secondary destinations. And it can, if you look at India from many aspects, we provide everything in healthcare through some of our elite hospitals. It's most comparable, competitive at US standard. India being as a top destination, not only in terms of experienced and standard of healthcare service provisioning, but also in terms of cost competitiveness. When it is benchmarked with the US, across specialty, we can average out as a 90% discount to the US cost. And that's where we stand. So very clearly, I have the fraction each and every country as an the medical travel destination. You can check India as one of the most valued travel destination. Partnering, the assistance program, what we usually drive in entire world, where we are improving access to innovative therapeutic medicines and quality health care. We offer assistance to all those patients who do not get a medication locally. We get along with the local hospital and doctors to help them to treat the patients first on the local platform in the local area, so as just because of this medication, the access to these medicines, patient should not travel to another country, and that's where the major cost saving can happen. It's not just a medical travel. We are offering a complete healthcare programs where with the different stakeholders like government, international societies, NGOs, we can create various kind of a collective awareness program locally, again for the provisioning base. We can create different kind of a program analysis, knowledge repository which we are having, at the same time helping the local organization or institution setting up a large scale health institutions. The MOZOCARE's landscaping, more than 200 hospitals on our platform, more than 100,000 experienced doctors, over 1,200 curated medical procedures, 40 plus patient care executive, 10,000 plus videos and audios available in our knowledge repository in multiple languages, and we speak many of the languages, 23 different languages covered worldwide. So that's a landscape where we stand for ourselves. Now, I'll not stop just here, but say, with the gamuts of a combination of all kind of a provisioning in the market, we welcome each and every stakeholders to come over for a further discussion and see that how exactly we can evolve together to fulfill your objective, your need from different markets, from India, from outside, inside, all side. Thank you so much.